Hello, my name is Dr. Komoshi. I'm a GP at King's North Medical Practice in Ashford. In this series we talk about common health conditions that could be treated without the need to see the GP. Viral warts are usually harmless, but they can be unsightly. Warts are most common on the soles of the feet and on the hands. Sometimes they could appear on other parts of the body, but it's less common. On the hands and on the soles, and they have the typical appearance of being a round-shaped, hard surface with dots and a little bit of crumbling on the top. On other parts of the skin, it looks different. It looks more like a soft bunch of skin threads. The diagnosis of viral warts are most commonly made successfully by the patient, but if there's any doubt, a pharmacist can help. The warts usually clear up without any treatment, but it takes time. If required, treatment could be applied to get rid of them more quickly. The two most common treatments would be salicylic acid, and the other one is different freezing techniques that are available as home kits or from private providers. Do we really need to treat the warts? Well, you can treat the warts if you find them unsightly or they are painful or troublesome. In children, half of them they will find the warts will go within a year, and 2/3 of them will be wart-free after 2 years. It might take a little longer for the immune system to recognize the infected cells at the bottom of the skin in adults, so it might take longer for them to clear the warts, but eventually all warts will go. Treatment could be applied, but you need to be quite determined because it's time-consuming. You might need up to 3 months to clear the wart. It is quite painful because all treatment that's designed to get rid of the wart is something to destroy the cells. And beside the wart cells, you will destroy normal cells as well, so it will be painful. Also, it can leave a scar, whilst if you leave it and your immune system clears it off, then it will heal without a scar. The success rate is disappointingly low, and the verrucas are stubborn, so they tend to grow back even after successful treatment. So you might not want to face all these difficulties, and you might decide to manage your wart until your immune system clears it. The best way to do that is to soften the skin by soaking it and then taking the surface off either with a pumice stone or a file to get rid of the excess skin that normally squash together on the feet, forming a very hard, pebbly feeling surface that gives you the pain on walking. So simply just taking the surface off might be enough for you to feel more comfortable. So if you decide to go for the treatment, the most commonly used is verruca, which is salicylic acid paint, and you can apply it daily on the verruca. Try to avoid the surrounding skin because it can irritate that as well. Please persevere with the treatment up until 3 months. When you see a good deep crater where the verruca was, and you don't see the dotty surface typical of the wart any longer, then you can stop the treatment but keep watching the area. If you see the wart coming back, please jump on it again and go to a deeper layer if you are still determined to treat it. There's no point really calling the GP asking them to prescribe something stronger, because in the UK we can only prescribe what is available over the counter. Also, NHS doesn't support surgical treatment for the verrucas given the risk-benefit ratio, and dermatology referral is very, very rarely supported unless the patient has multiple verrucas or immune problems. The freezing treatment comes in 2 forms. One is the home kits that you can buy from the chemist. It's about 4 or 5 repeated treatments weekly until you get to the bottom layer of the skin. Or you can see a private dermatologist, GP or nurse you can apply the liquid nitrogen to the skin. Again, quite a few treatments needed to completely cure the wart. A few tips to try to stop it from spreading. Please don't share towels or other bathroom equipment if you have warts, and consider wearing flip-flops in communal showers. However, when you go for swimming, you don't need to wear swimming socks. You might only just want to use a layer of salicylic acid verruca to seal the surface, trying to stop the spread of it. I understand that this could be quite disappointing with the stubborn warts. However, the good news is that if you don't want to treat them, you don't need to. I hope it helped. See you soon.